Our next speaker is Dr. Charles Elijah. He's the medical superintendent at the Lionheart Medical Center in Sierra Leone. He'll be sharing his experience on the use of BabyChecker in resource-limited settings and how the solution is being integrated into local health systems to reach more expectant mothers. Welcome, Dr. Elijah.
Good afternoon, all. So you may hear some background noise because I am in the hospital. I'll be taking you through the uses of BabyChecker in Sierra Leone, especially in rural settings of Sierra Leone. Of course, in Sierra Leone, it was introduced in the rural setting, and the use of it is for now a lot more common in rural settings than it is in other parts of the country. So I'll be taking you through the advantages that we have noticed with the use of BabyChecker in the rural settings of Sierra Leone. Because Lionheart, where I work, is in the rural setting, the centermost part of Sierra Leone, and extreme rural setting, and the PHUs in our catchment communities lacks a lot of other things that are required for establishment of a standard ultrasound scan. And as a result, we were introduced to BabyChecker a couple of years ago, and we are currently using it in some of our catchment communities. At the facility now, we are even trying to do a validation study to compare the result of the BabyChecker and that of the standard ultrasound scan to see if there are any differences. So far, that one is ongoing, and probably in coming months we will get the result ready. Okay, so I'll be taking you through. Next slide, please. Yes, so next slide. Yeah, so brief table of content. We'll be taking you through the definition, overview of brief overview, and then how the BabyChecker works based on our experience here in Sierra Leone and the advantages that it has over the use of a standard ultrasound scan in the rural settings of Sierra Leone, the limitations and possible recommendations. And then next slide, please. Yeah, so for definition, of course, this has already been defined by Akshay. Of course, it is an artificial intelligence device that is used for ultrasound scan. It consists of the BabyChecker, which is a mobile app itself, and a smartphone with an ultrasound probe that is connected to the smartphone. Next slide. Brief overview. Sierra Leone, a country in West Africa, is one of the countries with the highest maternal mortalities in the world. In 2023, the country's maternal mortality was around 354 deaths per 100,000 live births, according to UNFPA. And of course, a lot has actually happened over the years. It was a lot more worse than what it is now. According to data, about 75%, 74% reduction has been made from 2000 to date. And recent data will actually also reveal, preliminary data already shows that there is a significant reduction compared to this data that was in 2023. And of course, this one has not yet been published. Some progress has been made in this regard, but we are still far from reaching the UN's 2030 Supplementary Development Goals, which says that, or which aims at having a maternal mortality of 70 deaths per 100,000 live births. So though some gains have been made into this, but we are still far from achieving the UN Supplementary Development Goal for 2030. Next slide. Yes, so a country, Sierra Leone is a small country with a population of about 8 million. However, the population is small, but the number of medical staff, especially doctors in the country, is also equally small. We have about 800 medical doctors serving the country's population of about 8 million, which is a significantly small amount. And this is also coupled with inexperience and unavailability of the standard ultrasound scan. Of course, all of these are the challenges that are making it difficult to achieve the UN's 2030 Supplementary Development Goal. Okay, so Rural settings in Sierra Leone lack most of the amenities that are in cities, which are required for establishment of the standard ultrasound scan. Among them include the electricity supply. The rural settings in Sierra Leone mostly lack electricity supply, as you may see in one of our catchment communities, Mafe, where BabyChecker is being used. There is no electricity there. And of course, even in Lionheart, which is the town where the hospital is located, there is electricity in, of course, the hospital has power electricity from the solar energy and the generator, but the township itself does not have electricity. So that is the challenge that can actually affect the establishment of a standard ultrasound scan. One is a limited manpower, small doctor to patient ratio, and then we have a lot of the amenities that are required for establishment of the standard ultrasound scan, coupled with lack of the resources, makes it difficult. And of course, you need the ultrasound scan for reduction of maternal mortality. With the ultrasound scan, you'll be able to identify high-risk pregnancies even before they are term and even before it is time for their deliveries, and then you plan accordingly for them, thereby reducing maternal mortality. But this can be a challenge if you don't have ultrasound scan, which is the case in rural settings of Sierra Leone. Next slide. Yes, so of course has already been explained as to how the use the three longitudinal and 3 transverse sweeps, and then you get the results. Okay, this can be done by practically anyone. You do not have to undergo a specialized professional training for this, as it is required in the standard ultrasound scan. So anyone can be trained to do it. Can be a midwife, maternal and child health aid, MCH aid, any kidder or anyone can be trained to do this one, and it's very simple to use. Okay, so it doesn't require any special technical skills and can be done by practically anyone. Next slide. Next slide. Yes, so this is an image of what I was explaining as to how the 6 sweeps work. 3 transverse sweeps. The first ones are longitudinal, and then the second set of 3 are transverse sweeps. Thereafter, it will give you the results that you results of the gestational age, placenta localization, amniotic fluid, and so on. Next slide. Yes, so this is a picture of one of an MCH aid nurse, a maternal and child health aid nurse, doing a BabyChecker ultrasound scan in one of the catchment communities, which is Mafe village, and a village in an extreme part of Sierra Leone with no electricity. She did not have to do professional training for this. You can actually learn as to how to use it, of course, from the app itself. Okay, and then you can be able to do the ultrasound scan and get the desired result, even without uninterrupted electricity supply. Next slide. Next slide. Yeah, so it has a couple go back to the previous slide. Yes, so it has a couple of advantages. Compared to the standard ultrasound scan that we have noticed in our settings. Of course, among the many advantages is that it is very simple to use. You do not have to spend a whole lot of time trying to check for gestational age, trying to check for placenta localization, amniotic fluid, and so on. You can just do the 6 sweeps, and then within seconds you have the results. Okay, so 1, it is very simple. 2, it does not require a high professional skill that is required to do a standard, to establish and do a standard ultrasonography, and then it can be performed by practically anyone because it does not require a specialized professional skill. a high professional skill. It can be done by practically anyone. Anyone can be trained to do it. It does not also require the availability of uninterrupted electricity supply, which of course you will need if you want to be using the standard ultrasound scan, as like the one that you have in our facility at Lionheart. The catchment communities, they do not have the electricity supply, and they also we find it difficult to actually even establish that kind of ultrasound scan, the standard scan at those facilities. Okay, and it does not require it needs, it is cost effective relative to standard ultrasound scan, which is a little more expensive, sophisticated and expensive. BabyChecker is cost effective. You only need a smartphone with the app in the phone, and then you get ultrasound probe, you connect it to a smartphone, get the phone charged, and they are set to go. So it is cost effective. Okay, it is portable, can be moved practically from one place to another. Okay, it is not as difficult as it is to carry the standard ultrasound scan. It is very portable. Next slide. Yeah, so in the previous slide were the numerous advantages, there are so many more, but those are the ones that we have been able to realize from the use of BabyChecker ultrasound scan in our catchment communities and our facility and the catchment community. And then, of course, it has a few limitations because one of the limitations is that for now, it is not available in several parts of Sierra Leone. So that is, of course, for now a limitation. In Tonkolele district, for example, even in our catchment communities, it is not every PHU that is using it, but it is the PHUs that are actually using it are mostly the PHUs where piloting the BabyChecker project in Sierra Leone started and it's still ongoing. And then at the facility now, we are trying to do the validation study. So we still have a lot of other communities that actually need portable, very effective and less cost effective and very cost effective rather ultrasonography to be done to help prevent maternal mortalities. But of course, the device is still being developed, and of course, it is very useful, but still very limited in Sierra Leone because we have a lot of other rural settings in Sierra Leone that still do not have it. So I guess one way to actually also reduce or make ultrasonography accessible is by making available the one that is cheap and very easy to use in communities, hard to reach communities, where there is no electricity for the staff or healthcare workers working in those communities to be using it. Okay, so the BabyChecker ultrasound scan has so inavailability in most parts. These are all the limitations. Inavailability in most parts of Sierra Leone or most PHUs, and then of course it is an ultrasound. It is it is a mobile app. Though limited incidents of this have been reported, but like any app, it is liable to malfunction. And of course, if it malfunctions, then you might have difficulties using it at the time when it malfunctions, and you might also probably not be able to get a desired result. However, like I said, a lot of incidents of this nature have not been reported, but like any app, it is liable to malfunction at some point. Okay, so that is one of the limitations. Next slide. Next slide. Next slide. Next slide, please. Yes. So back to the previous slide. So one of my recommendations is that because it is difficult to get a standard ultrasound scan in every part of the country, in every part of Sierra Leone, and with the demand and with the government's desire to reduce maternal mortality, it is important that we invest more in BabyChecker and try to make it available in several parts of the country, because in our communities, we have actually helped, we are having less maternal mortalities now compared to the time when we had the BabyChecker introduced in some of those communities. Because how it works is that at those communities where they are using the BabyChecker, the PHUs where they are using the BabyChecker, when they detect a high-risk pregnancy, they will refer the patient to a secondary facility, which is our facility, or any other secondary facility. But at the moment, those catchment communities, because they are in our catchment communities, they are referring to us, and then we prompt intervention over the years has helped to reduce maternal mortality. So even in our catchment communities, relative to the when we didn't have a BabyChecker introduced in those communities or in our catchment communities, now we have a fewer maternal mortality compared to them. So investing more into it can help to actually reduce maternal mortality and maybe help us to achieve the UN's 2030 supplementary development goal of achieving 70 maternal deaths for every for every 100,000 life births. Next slide. Next slide. Next slide.